Hi, Betty. Welcome back. It's great to see you again. So, first of all, I have good news for you. You've done the right thing in coming to see us. After reviewing your x rays and the series of exams we performed, I'm feeling very confident that what you have is treatable with chiropractic. So, the good news is you're in the right place at the right time. But now that we've established that what you have is a chiropractic issue, I want you to know a few things about it before we get started. As you may remember from the video we had you watch, chiropractic is not new, it is not experimental, and it's been a successful form of treatment for cases just like yours for over 100 years. In fact, the results of chiropractic have become so popular and so successful, it is now the second largest healing practice in the Western world. And what's most important for you to know is that a study by WebMD following 2 million patients over a course of 4 years demonstrated a 95% satisfaction rating with chiropractic. 95%. Now let me tell you, in the medical world of healthcare, it's impossible to find a better record than this. That's why you can feel very confident that you've come to the right place to find the solution to your healthcare problems. Another very important thing that you need to know is that chiropractic is natural. In today's day and age, it's becoming increasingly more important because let's face it, we've all become way too drug dependent. Your body's been made with this amazing capacity to heal itself that far exceeds anything that man could create, like a drug. Your body's better than a drug, and we need to rely on it first. In fact, have you ever thought about how your body heals itself from something as simple as a cut to the finger? Well, it stops the bleeding, it repairs the tissue, and within a short amount of time you can barely tell an injury has occurred there in the first place. And it's able to do this through the control of a system which we call the central nervous system. Now this system knows better than you do what it needs to make the body healthy. And as chiropractors, we remove nerve interference so that your body can more correctly diagnose and heal itself naturally. That's why your first choice on your healthcare journey should be one that's natural, not one that's heavily reliant on drug therapies with their harmful side effects and risk for addiction. That's not to say that drugs don't have their place, because of course they do, but they should be used as a last resort and not as a first. Let's talk a little bit now about what brought you in here. Let's talk about your condition. Why do you feel the way that you feel, and why are you in the pain that you're in? Well, I'm here to tell you your issue didn't begin yesterday, and it didn't begin the first moment you were feeling pain. Pain is usually one of the last indicators to the body that something's going wrong in the first place. Your issue has been building up over a long period of time and is the accumulation of all the events in your life. Your issue, in fact, began with the traumas of childbirth, and anyone that's seen a child being born can attest to the traumas that occur to the head, neck, and spine as we all go through this process. And it doesn't stop there. Think about all the hundreds of falls, spills, and accidents you've had through your childhood and into your teenage years. You've needed this care as you've been growing up. It's amazing that any of us live past the age of 5 with all the hits and injuries our bodies take. If you would have had this care as you've been growing up, it would have saved you from a lot of the wear and tear you're experiencing now. The reason I'm telling you all this is because if you have kids, or if you're planning on having kids, they're probably going to live to be 100 years old. And we want to make sure that they're as mobile as possible and living the best lives they can throughout those 100 years. Let's take some time to talk about your lifestyle now. Betty, it's impossible to count the number of improper lifts and physical traumas that have occurred to your body over your lifetime. That's why we say it isn't just one event. This issue's been building up over a long period of time and you have wear and tear already. But keep in mind, this is with no prevention, no treatment, no care, no effort whatsoever to offset any of these issues from occurring in the first place. As an example, let's turn to the dentist. Imagine you never went to the dentist or brushed your teeth. Nothing, from the moment you were born to where you are now. Imagine what kind of condition your teeth would be in. It'd be amazing to think that you'd have any teeth left at all in your mouth, am I right? The same thing's been going on with your body. You have a lot of untreated nerve and tissue damage that has been left to accumulate. So it's a good thing that you're not in worse shape than you're in already. Now, it's taken some time for this condition to build up, so it's going to take some time to get out of it. Just like if we put on weight over a 10-year period of time, we'd all want it to be off in 10 days. But that's simply not how the body works. These issues take time to create, so they're going to take some time to fix. But we'll talk more about the timing of your treatment as we move forward. Right now, let's talk about where you are now. Let's talk about the results of our exams and what's the result of all this wear and tear on the spine that's been going on. Well, your spine has been pushed and pulled out of alignment, causing a decrease in flexibility, leading to irritation, swelling, and a pinching of the nerves as they flow out from in between the individual segments of the spine, which we call vertebrae. Now, the medical term for this pinching is called a subluxation. And if you look at this chart over here, you can see some of the things that occur with subluxations in different regions of the body. And I think you'll find this part fascinating. It demonstrates why so much of your overall health is affected by subluxations. And the reason for this is because nerves run from the brain to communicate all the commands to all the parts of the body and all the organs that are there. That's how your body knows how to heal itself and function properly. Now, you came in here with low back pain, but I'm here to tell you if it's left untreated, it could lead to pain in the legs, pain in the groin, and even possible abdominal issues. This may sound like some of the issues you're having already. And the reason for this is because nerves work a lot like today's cell phones. When there's interference in a call, what happens? The call breaks up or it drops. And what do? We move to the nearest position possible to try to get rid of this interference. The same thing's been going on with your body. As chiropractors, we remove this nerve interference so your brain can communicate with your body and heal itself properly. I'd like to take some time now to talk about the degeneration process of the spine. There are 4 phases to the degeneration process of the spine. Just like many other diseases have stages, let's talk about cancer because it's an example that we all know something about and we all can understand. As cancer is left untreated, it progresses through the various stages and your symptoms and severity of the disease become worse and it takes more treatment to get you out of. That's why it's very important we begin treatment now so that we can stop any further degeneration from occurring. Right now, I'd put you at stage 2 of the degeneration process. But let's take a look at your x-rays so you can see a little bit more about what I'm talking about. Now, since you can't take these x-rays home with you, I'm going to circle on this chart here the place that most exemplifies where you're at right now. So you can take it home to your friends, families, and loved ones and show them exactly what we've been talking about here today. So I'm sure they'll all be interested. Now, we've talked enough about the cause of your issues and what's been going on. Let's talk about what you came here for. Let's talk about your solution. The solution here is going to be a series of adjustments that I will perform to your spine. I want you to know a few things about these adjustments since you can't see what's going on. 1, I'm removing nerve interference so your body has 100% capacity to heal itself from any current pain or illness your body's in right now. 2, I'm removing nerve interference so your body has 100% capacity to prevent future disease and injuries from occurring in the first place, so you don't get so sick to begin with. And 3, I'm removing nerve interference for your body's future musculoskeletal performance, so you don't get all this wear and tear buildup to begin with, and you don't get into such a severe state to where you're in the pain that you're in now. Now, your spine's been misaligned for so long, it actually considers this misalignment to be normal. We're going to have to retrain it, and frankly, this is going to take time. I'm going to adjust your spine, and it's going to adjust back to where it's used to being, kind of like 3 steps forward and 2 steps back. But with enough adjustments and enough time, eventually we'll get your spine back into the proper alignment and get everything functioning correctly and get you feeling better. Now, a moment ago, I said that this is going to take a series of adjustments. Did you catch that? This is for the exact same reason that you don't go into an orthodontist and they put all your teeth back in the right place on one visit. They, like us, will tell you it's going to take a series of visits, and with enough time and enough treatment, they'll eventually get your spine working, or your teeth working back in proper position, just like we'll be getting your spine back into its proper alignment. Now, I've broken your healing down into 3 phases. The first phase, and the phase you probably care most about, is the pain relief phase. Now, everyone responds a little differently to this phase, but for you, I'm recommending that we see you 3 times a week for the following 4 weeks. It's during this time that we'll also be supplementing your care with some additional therapies to help you along the way. And by the end of this time, you'll be out of pain, and you'll be thinking to yourself, great, I have no pain, the problem's solved, right? I'm better. Well, I have a little bit of bad news for you. The truth is that your spine's been out of this position for so long, and that when we get it back moving, you're going to be in an unstable condition. And any normal thing like grabbing and reaching down, twisting and turning, normal events that usually wouldn't cause you any issue, can set you back to where you are now, or even possibly make things worse. That's why the second phase of your healing is so important. It's the stabilization phase. Now, before we get to that phase, I'm going to do a short progress exam to make sure that you're ready to move on to the next step. And I'm sure you will be at this time. Once we get here, things will get easier for you. During the second phase, we'll be providing adjustments 2 times a week for the following 3 weeks. And again, I think this is going to go easier for you as we get to this stage. Now, after this, I'm feeling very confident that based on the number of cases I've seen like yours, that your condition will be stabilized and your muscles will be functioning properly. Again, we'll do a short progress exam to make sure that this is the case. And if you are functioning well and things are going as we plan, we'll move you on to the third phase. The third phase, in my opinion, is the most important phase. It's the wellness phase. The reason the wellness phase is so important is because the truth is we're not stopping what caused the subluxations to occur in the first place. Just like with your teeth, it'd be amazing if you could brush them one time and they stay that way for the rest of your life. But that would also mean that you wouldn't be able to eat again. Just like with your body, we don't expect you to stop doing the things that make you you. We don't expect you to stop going to work. We don't expect you to stop having fun with your friends and family. But the difference here being is that we're going to provide a series of adjustments to help counteract any wear and tear from building up so you don't get back to this debilitating state that you're in. Now, in order for us to accomplish this, I'm going to need some things from you. Firstly, I need you to attend all of your scheduled appointments. Don't miss any. It's the number of treatments and the frequency of those treatments that make chiropractic care work so well for you. Secondly, I need you to attend a class called the How to Stay Young for Your First 100 Years. This class is chock full of information that I know will be super helpful and relevant to what's going on in your life. And feel free to bring any friends, families, and loved ones with you, because I'm sure that they benefit from the information as well. And thirdly, if you do miss any appointments, we understand that life happens and there are changes. But if you miss any appointments, make sure that you make them up. Because again, it's the number of treatments and the frequency of these treatments that make chiropractic work so well. So, I'm going to sign here saying I've given my best recommendations, and I want you to sign here as well, saying that you're going to make every effort to comply with them. Now that we've done this, I'm going to go ahead and grab Melissa, and she's going to come in here and go any financial statements that you may have concerns about, as well as get you scheduled for your treatments and scheduled for your How to Stay Young class. We have these times at 4 p.m. on Wednesday and Friday at 9:30 a.m. for those classes. So I'm going to go grab her, and then afterwards we can continue. Now that we've gone over this, I'm feeling very confident that we can begin your adjustments. Are you feeling ready? Awesome. Natural wellness is what you need, and it's what we can provide here. With our chiropractic treatment, you'll be feeling better and better, and we'll get you to the right place at the right time. I hope you have a great rest of your day, Betty, and enjoy the rest of your time with us.